Hi everyone, Dr. Cary Yurkiw here. Thanks for joining me today for this webinar called Thriving Without Burnout. Build a profitable, balanced practice you love. And a lot of healthcare professionals that are out there in private practice, they get very stressed about different aspects of practice. And there's so much to know about being a health professional, especially when you're in private practice. You know, we're well trained in our respective disciplines. We're experts and specialists in areas, which allows us to be, to do an important job for our patients. But sometimes we're not trained on managing staff, managing our own business, growing a business, how to handle the growth. So there's all those business parts about running a practice that we don't have any training on, and this is where we can really run into trouble. It can become stressful, and sometimes it can even affect the outcomes of our practice itself. So just the success of our practice. So today I want to talk about thriving without burnout. And I want to talk about what you can do to improve some of those stressful situations. So, excuse me, are you feeling overwhelmed or out of alignment? Maybe you didn't start your practice to burn out. You started it to help others, and you want to thrive doing it. You don't want to stagnate as far as your growth goes. You don't want to be overworked and overloaded. Without delegating to employees. You want it to be joyful growth. You want to help more people. You want to do better in business, of course, with your practice. And you want to balance your energy levels. You want it to be a good mix between the work you do and your home life and some of the hobbies you might have. For example, today we're in the clinic. It's a holiday actually, but we saw some patients, including a couple emergencies. I'm almost done now with my patients here, and I'm going to be leaving the practice to go for a 10K run. And it's something that I love to do is run, and you might hear me talking about running marathons and some of the races I've done. You might see those medals up there on that picture. So that's one of my hobbies. And family time later today with my family, being the Easter weekend, very important to spend time with family, your relationship with God. It's all part of being a successful health practitioner. So we want to talk about shifting from being overwhelmed to joyful growth. My name is Dr. Cary Yurkiw. I've been a chiropractor for 31 years. I've also had other professionals working for me in my clinic. I've consulted with different doctors and therapists. And I've written books on practice management as well as the conditions we see in my practice. So at this point, we have a growing consulting company. It's called True North Consulting. And my plan is to continue to grow that consulting company down the road to help more doctors and therapists succeed. So I've been doing this for the coaching part for a few years now, and public speaking probably for about 20 years, and the authorship for 7 years now. So this is kind of the next phase in my career, is helping health professionals with their practices and grow their clinic. So what are you going to learn today? How to reignite your purpose and leadership, why you became a doctor in the first place, what leadership skills do you have, and what are you going to do to improve some of these skills. How to attract and retain ideal patients. Sometimes I refer to this as your avatar. You want to identify who your ideal patient is, then you want to go out and market to them. That could be through referrals. It could be through your imaging, your messaging on social media, or even on your website. So you want to build strong patient relationships and relationships with your ideal patients in the community. You want to create balance without sacrificing income. So you want to achieve a work-life harmony. And one of those ways you can do that is by delegating tasks. So in the office, and we'll focus on that today, just delegating tasks to your staff, training your staff, helping them overcome obstacles, helping them to grow as individuals. It should be a win-win situation where they're growing, they're getting skills that can translate into them being more valuable to your clinic or to their career, and you're getting the effort to help offset some of the responsibilities that you have. I guess in an ideal situation, you want well-trained staff, and you want to delegate to them so you can focus on what you do best. You want to streamline operations with simple systems. That's something that I'm known for, is efficiency with systems in the clinic. So just keeping the clinic on time, processes to follow, and proper follow-up. What to do if something happens. So, contingency plans, plan B, plan C. And you want your staff to be well trained on these areas because that's going to help you to handle different situations that pop up on a day-to-day basis. And you want to build a growth plan tailored to you. So you want to develop a personalized growth strategy. Everybody has different goals and growth goals. And it does start with that initial step, which is just that visualization of what you want to achieve long term. So you need to sit down and think about it. You need to meditate on it, write down in a journal. I like to have these small journals that I write my thoughts in, these little ones like that. And I use AI too, like ChatGPT. And just, you want to vocalize and write down some of your ideas and develop that into a plan. And ChatGPT does a really good job of that. So does Grok. So any AI like that will help you to flesh out some of the ideas you have, make it into a plan that can be shared with your staff. So why do so many health professionals burn out? Well, they're overbooked and underpaid. So, there's challenges with booking. Sometimes you have patients that don't show, so you're double booking. Sometimes you want to squeeze your regulars in, and you've got new clients. So there's all sorts of reasons why you could be overbooked. And underpaid, depending on what profession you're in and what you're doing, sometimes dealing with insurance companies, cash paying patients, there's challenges with getting paid, and the payment systems, they should have their own processes and their own systems. So you maximize the payment system, and you've got people in charge of these processes so that you don't have to deal with them on a day-to-day basis. If you don't have systems, things can break down. It becomes very subjective based on the person who's doing that task. If you've got a really good person, it might be okay, but if you've got an average person or somebody is not well trained, these systems can break down and cause upsets for you, the health provider, and you don't need that, because you want to be focused on what you do best. And sometimes there's misaligned values. So basically, it's not clear to yourself first, but it's not clear to your staff and your team what the values are and what you're trying to accomplish in the clinic. So there's a 5-step model to building the practice you love. I think the first one is vision and clarity. So you want to make sure you're really clear. And like I said, just starting with the plan, kind of writing that down, voicing it, and fleshing that out to get clarity. Then you want to simplify your systems. The important ones, you want to have step 1, 2, 3, 4 very clearly outlined, because that's going to be the structure, the backbone for your practice. That kind of frees you up to do the things that you love to do, right? To treat patients, to talk to patients, to help them. So the systems really free the practitioner up. That'll build a patient base because you'll have your regular patients, you're going to get referrals, and you're going to be building your practice that way. You want to create healthy boundaries. So these boundaries are areas where if you're not comfortable, let's say, you want to know what you're comfortable doing and not comfortable doing, as well as what I talked about earlier. You want to delegate tasks to your staff, and you can continue to do what you're best at. And then that'll allow you to scale. So you'll have more free time, you'll be energetic, and that's going to allow you to scale your practice to a bigger and better place where you're helping more people and you're more profitable. So when you make that shift, it boosts your business because it reconnects with the why, the reason why you became a health professional, the passion you have in your practice. So, you want to reconnect with the reason why you became a healthcare provider in the first place, and that's to change and save lives. So you want to reconnect with that. You want to have renewed confidence, so in yourself and your team, be a good leader, self-assurance, or you basically want to have confidence and relay that confidence to your staff. You want to increase revenue, so you want to do better financially, less work, and time freedom, more time and more efficient staff. And everybody wins that way. It's a win-win situation. Now, if you're interested you want to know more, as we develop different systems in our consulting company, True North, we're going to continue to update you with the offers that we have. Today, we've got a free 15-minute strategy call with me. To book that call, I'm going to give you the QR code in a minute. I'll also type that link in the chat, so you can click on that link and then you can book that 15-minute call. Other things that we're working on, a short course on this. So if you found that you're interested in this topic, but you want more in-depth knowledge, we're developing a course on this topic that you can take and basically share with your staff. You can sign up for our newsletter. We do a weekly newsletter keeping you posted on the upcoming webinars and the master classes that we have, as well as the health coaching sessions. And sometimes you'll get an offer like this one where you get a 15-minute free session. If you want to sign up for that, just reach out to us via DM or comment here on YouTube in the chat. You can just say you're interested. We'll reach out to you, get your email address and your name, and we'll put you on the mailing list. And that way you can stay in touch with us. You want to identify obstacles, pinpoint what's hindering your progress. So it's important to assess your clinic fairly. Sometimes it's good to have a coach like me to assess that, because it's hard to remove yourself from the environment. Sometimes you're in the thick of things, kind of in the weeds, and it's hard for you to see the forest from the trees. That's a good analogy right there. And then you want to gain clarity. Helps you understand your current challenges and your future goals. Now, you don't need to hustle harder. You just need to build smarter. Exactly. So it takes a bit of planning, some thought, then the action, and then you want to assess, how is your practice changing? How is it evolving based on what you're working on? Now, if you want to book a call, very easy. You can scan this QR code and then book a free 15-minute strategy call. We'll use Google Meet or Zoom, whichever you're more comfortable with, and we'll do that call when it's convenient for you. I have certain times in the day where I don't see patients that I can do these strategy calls, so feel free to scan and jump on that call. You can also call or message us at that number below. Sorry, I just moved my cursor. 778-215-9310. Feel free to text or call, and we can book a strategy session that way. So I want to thank you for joining me today. I really enjoy doing these webinars, sharing my knowledge with others, encouraging doctors and therapists to take the next step, to not be afraid of change or challenges. And I will talk to you guys at the next webinar, or hopefully on a 15-minute strategy call.